Welcome back. The General Secretary of the Civil Service Association is calling for understanding and compromise from government establishments where employees have tested positive for COVID-19. The CSA, which is the main union covering public servants, says whilst they understand and agree with the concerns of employees who do not wish to return to work, in the end, there is a job to be done. However, the association says employers need to ensure the safety and peace of mind of all staff. Rochelle Gonzalez reports.
On Monday, October 26th, the Ministry of Education revealed that an employee had tested positive for COVID-19 and that there was an immediate drive to start the contact tracing efforts by testing members of staff. In a press statement announcing the new discovery, the statement also notably asked staff to continue to observe protocol, wear their masks, and report to duty, as the ministry saw no reason to suspend services. This did not sit well with the employees of the ministry, as reports surfaced that a number of staff members decided to stay away from the premises. A memo was then sent by the ministry asking them to get up, get dressed, and show up. The memo also revealed that sanitization efforts would commence on Friday and end on Saturday. This led to the workers paying a visit to their union, the Civil Service Association, to voice their concerns. Secretary General of the CSA, Claude Paul, said the workers do have a right to feel apprehensive, and so the ministry needs to pay attention to their grievances.
We are aware that the PS has issued a memo which is suggesting that some work has started and will be continuing the coming weekend. Our view is that we need to approach the situation with caution and to make sure that workers are safe. Now, if workers are of the view that the conditions under which they are going to work have not been properly dealt with, well, you know, one can understand their apprehension, one can understand their concern. So what I would like is for the ministry to be sensitive to the situation and to meet the workers halfway as far as their own fears and apprehension is concerned. And of course to give as much information as possible to allay the fears of the workers.
On the other hand, Paul said there is work to be done, and so there should be some form of compromise.
The issue with COVID is still not clearly understood. As to whether the workers have a right to express reservations, I would say in an environment of uncertainty, one can understand that. On the other hand, there is a responsibility to do your work, to come to work, but it is always be in the context that the environment is safe. So if the perception is that the environment is not safe, the workers have a right not to go there. And that is the position the Labour Code speaks clearly on these matters. So it is either through information which can clearly explain to the workers what the situation is. So let's rely on science, let's rely on facts. And I think it's the responsibility of the employer to provide that information and give clarity to the workers.
The source revealed that the names of persons staying away from work was being recorded and that they feared being penalized. To this, Paul said this step is unwarranted.
We have to bend over backwards to accommodate workers in instances where they perceive that they are not safe. And this is where the union will say, to suggest that you're going to take draconian measures and discipline people in a time like this, that would not be the appropriate response. Let us try to work with people, clarifying doubts, and giving them the information so we can make informed decisions.
Paul said there is a need to balance the information being received, and so the CSA is monitoring the situation closely, whilst at the same time asking for tolerance from both parties. Reporting for Hot 7 News, I am Rochelle Gonzalez.
Meanwhile, St. Lucia's Consul General for Martinique, Joanna Salton, spoke to Hot 7 TV about the welfare of St. Lucians living in Martinique. She says people seeking medical attention in Martinique and those wishing to return home to St. Lucia will still be accommodated via the Consul General's office during the lockdown. She also spoke on the concerning issue of illegal backdoor entry into St. Lucia from Martinique. Martinique has a large St. Lucian immigrant population and is the island's closest neighbor. The French overseas territory is currently in the thick of a second wave of COVID-19, which has necessitated lockdown measures. This comes after a little over 700 cases were recorded within a week. St. Lucia's Consul General for Martinique, Joanna Sultan, explains that for St. Lucians, access to medical services during the lockdown has been a main concern. The French borders are closed, but through the Consul General's office, people needing access to medical care and services and those needing to return home to St. Lucia will continue to be facilitated.
We do have a boat that operates between St. Lucia and Martinique, and this boat was actually put on by us for those people who are seeking medical assistance in Martinique. So that was the main concern of most people who called. They were like, is the boat still going to operate? I have an appointment in Martinique. I need to come up. And even those people, the Lucians who have their French cards and who need to return to Martinique, that was their main concern. So we got a lot of calls about whether the boat is still going to be operational. But like I explained to them, the boat was operational back then, and it is still going to be operational.
Here in St. Lucia, authorities have identified illegal backdoor entry from Martinique into St. Lucia as a big contributor to a spike in cases here on island. Sultan says discussions are underway with Martinican authorities to address this issue of illegal entry into St. Lucia from Martinique.
Well, actually, we did receive a request from Mr. Francis, the Minister for Home Affairs. So this request has been transmitted to us, French Embassy, as well as Director of Maritime Affairs. In fact, this morning I did receive a call from the Director of Maritime Affairs. So discussions are ongoing. We expect to see something happening. So I think in that respect, we are working on it, definitely.
As for the mood on the ground for St. Lucians living in Martinique, Sultan says what has eased some of the stress associated with COVID-19 protocols and having to enter a second round of lockdown measures is the access to passenger and freight services provided by the Consul General's office.
Initially, when the borders were shut and we didn't have the boats, we had people, families who could not send care packages down for their families in St. Lucia. Now that we have put the freight aspect on, because before we were just transporting passengers, people, now we put the freight aspect on, and it's been on for about a month. We have a lot of people in Martinique sending care packages down to their families, so I'm happy that we were able to facilitate that. So that has helped a lot of people in St. Lucia. I mean, from what I understand, there's even stuff that comes down and, goes to their families, and, they can distribute to friends and so on and so forth.
Any St. Lucians requiring medical attention in Martinique are asked to contact the Office of the Consul General to get the appropriate documentation to facilitate access to those services. Here in St. Lucia, opposition leader Philip J. Pierre has ascribed the unfolding COVID-19 situation to premature declarations of success over the pandemic by the government. Pierre has called on the UWP administration to step back and reassess their commitments to capital projects. He believes that it is unjustifiable to continue investments into road projects while the country spirals into health crisis.
On numerous occasions, local authorities have been known to tout the island's successful mitigation of the COVID-19 pandemic. During her first address to the House of Assembly, newly appointed Government Senator Ferropolius stated that St. Lucia's successful COVID-19 response was a model to be followed by countries globally. However, speaking against the backdrop of a spike in COVID-19 cases and the confirmation of community spread, leader of the opposition Philip J. Pierre believes that the sitting government and its surrogates may have spoken too soon.
Victory was claimed very early. We could show the world how to handle COVID. We could open our tourism industry. We could be a model for the world how to open our tourism industry. Victory over COVID was claimed too early. That victory was politicized too early. A Labour Party government would never have, even when the cases were low, to have politicized it and made it sound as if we are out of the blue. When we stated that we are not out of the blue yet, we were called prophets of doom and gloom.
Pierre is calling for funds to be redirected from capital projects and be used to build the island's testing capacity.
Can you, with any certainty, say you can walk out somewhere today and get a test? That should be possible. We should have had PCR testing. We should have increased our testing capacity. We should have used these resources for that. Instead of putting it in a road. Tell me something. When that work at Roundabout is completed, what benefit is it for the well-being or the health of the people of the country? It's like all Roman times, all Roman times, when the king was coming, they paved all the roads for him. I'm calling on the government again to reprioritize these expenses so that the people can benefit directly.
The opposition leader says it is time for the government to head back to the drawing board and return with a plan to address more prominent issues than traffic congestion. Jacques Wooding, Hot 7 News.
The National Workers' Union is standing on the side of workers who, out of concern for their health, choose to stay away from the workplace in cases where colleagues either test positive for COVID-19 or have been exposed to the virus. Secretary General of the NWU, Joanne Haywood, said the matter is bigger than just one incident, as the virus is all around us, and so people's rights must be respected and all must play their part to uphold protocols.
Your right to exercise, I guess, your position if you feel that you're threatened, your health and safety is threatened in the workplace, whether it be from COVID or any other hazard for that matter. But, you know, we have to work collaboratively, all stakeholders, government, private sector, the unions, etc. Because as people leave their homes every day, you know, you have to face the buses, you have to face the supermarkets, you have to face your place of work, hotel, wherever the place may be. And the risk of exposure and contracting the virus is real, it is there. We're now at 73, I believe, confirmed cases. And we've heard what's happening in terms of where these cases are coming from, in terms of one or two maybe at certified hotel properties or COVID properties and so forth. So we have to just ensure that as best as possible, the protocols are reiterated, they are clear for everybody to understand and follow. And as best as possible when it comes to training and sensitizing workers as it relates to what procedures and protocols they must follow, that it's at it.
Haywood says the NWU will always stand on the side of employees who face such dilemmas. Chief Medical Officer Dr. Sharon Belmar George admits that her role in the COVID-19 response has not only been demanding on her professionally, but has significantly cut into her personal life as well. As she appeared on Hot 7 TV's The Hot Seat, the CMO delved into the challenges that her important role has placed on her life as a mother and wife.
For the past few months, the Chief Medical Officer and her team have been working around the clock to manage St. Lucia's response to COVID-19. Dr. Sharon Belmar George has become a household name, and her performance has been commended by all facets of society. The CMO attributes this success to hard work and commitment, revealing that her role has proven to be very demanding on her professionally. She admits that often she has little time for herself, and although her commitment is unwavering, managing a pandemic has had a significant impact on her family life.
For me, I think this year and the whole COVID outbreak has changed everything that I was supposed to do. My scheduled vacation before my kids come on entrance, I couldn't take one day of it. The support that I normally give to my family has not been there because I'm a housewife at heart, so I cook and I'm always reorganizing the house, in the garden, in the yard, in my spare time. So a lot of my other activities has really been out of focus with COVID-19. I also do aerobics, which I can't keep a full schedule of because it depends on what's happening at work. I get home too late. So I'm at the point where I'm trying to create a balance just because it's important as well for my mental health to keep healthy.
She says throughout these challenging times, she has been lucky to have the support of her family and friends. As in many instances, where her work has taken her away from her duties as a mother and wife, they have always been ready and willing to fill the gap.
I'm blessed with an extremely supportive family. My husband had taken up the role, especially in the more difficult time of trying to do everything with the kids. I have my sisters, my cousins, my aunts, everybody has been available.
Since there is no foreseeable end to the COVID-19 pandemic, the CMO says she will continue to adapt and overcome, hoping to return a level of normalcy to her personal life. Jacka Wooding, Hot 7 News.
Stay with us. There's more after the break.